And joining us now on the line from Calgary, Alberta, Nadeem Esmail, manager of the Alberta Policy Research Centre at the Fraser Institute. Nadeem, good to have you on the program again. How are you tonight?
I'm very well. Thanks for having me on the show.
Not at all. You and I are going to make sure that our viewers are complete and utter experts on all the differing European healthcare models over the next 15 or 20 minutes or so, okay?
We'll try.
Here we go. Let's take a look at a couple of the systems in particular, Switzerland and Germany, for example. What's the biggest difference between how they run their systems and how we run ours?
It's really a sea change in terms of difference. In Switzerland and Germany, you actually get to buy an insurance product from an insurance company, and you're responsible for ensuring that you are insured as an individual in these healthcare systems. It's not a tax-funded, government-run insurance scheme. Rather, it's a privately operated insurance scheme where the government provides a backstop to ensure that everyone has access to that insurance marketplace. In Switzerland, about 40% of the population does get an income subsidy to help them access the insurance marketplace, but it is an individual contract between a person and an insurance provider.
So is that to say there's a much larger role for private insurance companies in that system than we have here?
Absolutely. There's a larger role for private insurance companies. There's also a larger role for private healthcare providers. The insurance companies buy their healthcare services from public and private hospital care providers, which means as an individual relative to Canada, you have much more choice about who's going to pay for and who's going to deliver your healthcare service within the Universal Access Health Insurance Scheme.
Okay, we're going to get to whether it works, it doesn't work, strengths, weaknesses as we go along, but let's just continue our look through the map of Western Europe. How about the French system? How do they finance their healthcare system?
The French healthcare system is an independent insurance scheme from government, so it's not necessarily government specifically that's delivering the insurance. It's an independent group, but you do get to access that group on a universal basis. The premiums are income related. There are some tax subsidies as well. It sort of falls partway between what you see in Germany and Switzerland and what you find in Canada, where the government provides all insurance. It's sort of a middle road where you have an independent insurer in place.
Okay, in which case, let's just consider the total healthcare costs so far. I think the most recent year for which we have figures available from the OECD are 2005, so we'll use those numbers. Here's the percentage of the gross domestic product. The Canadian healthcare system consumes 9.9%, France much higher at 11.1%, Germany at 10.7%, Switzerland even higher than all the others at 11.4%. Now let's do one more graphic here, and this one is total healthcare cost, percentage of GDP age adjusted, and we'll get to that in a second. If you adjust for age, Canada suddenly shoots up to number one, 11% of the economy, France at 10.6, Germany lower at 9.1, Switzerland again a little lower at 11.0. Just to help us understand this, what does it mean when they readjust the figures for age?
Well, it's important to account for the fact that Canada actually has one of the youngest populations in the OECD. We have about 13% of our population over the age of 65. The average country is over 14%, and you have some countries, including Japan, at around 17 or 18%. And we have to account for this, understanding the reality that 13% of Canada's population is over age 65, but they consume more than 44% of healthcare expenditures. And of course, we know that healthcare expenditures rise quite significantly after the age of 65. You'll consume about 50% of your lifetime health spending after you're 65 relative to before. So we account for this fact when we do the age adjustment, and that's what moves Canada's numbers up in terms of healthcare expenditures. It also means that Canada can get away with fewer doctors and fewer MRIs than other countries, and when you age adjust those comparisons, we also have to adjust Canada upwards in those measures as well.
But presumably if we spend more on older people and we're aging as a society, that 11% is going to move to 12 and 13 if we keep going the way we're going. Is that right?
If we keep going the way we're going, we are going to see higher and higher expenditures in the future. The reality is the baby boomers are coming, and they're going to be very expensive to care for in the future. There's also a question of whether or not they'll be willing to wait the amount of time the Canadian healthcare system normally requires of patients.
Here is another chart I'm going to share with you and our viewers now, and this one, we're going to take a bit of time to go through this because this has got a lot of numbers here, and I'm going to beg everybody's indulgence to go through this with me. This is health expenditure by source. Health financing year 2000. We got France, Germany, Canada, Switzerland once again. And then if you look at the public piece of the expenditure, the first column, you've got France at 76%, Germany 75%, Canada at 71%, and Switzerland well down at 56%. If you look at the private insurance component, you've got France at 12.7%, Germany almost the same, 12.6%, Canada a little lower at 11.4%, Switzerland at 10.5%. Here's the most important column that I want to get to. The out-of-pocket payments that patients have to make. France, very small at 10%, Germany, very small at 11%, Canada, a little bigger at 16%, Switzerland, out-of-pocket payments fully 1/3% of healthcare expenditures. So if you consider all of those numbers, are you able to come to a conclusion as to which healthcare system for the average person is the most affordable?
I don't think you really are, and one of the problems with comparing public and private expenditures across country is recognizing that different countries cover different things under the public scheme. In Canada, we're quite unique that we cover physicians and hospitals under the public scheme almost 100%. We don't allow private financing for those services, but pharmaceuticals, dental care, and any number of other services are actually outside of publicly financed healthcare for most Canadians. When you get to the European countries, the public healthcare systems, the universal schemes, actually cover physicians, pharmaceuticals, hospitals, a broader range of healthcare services. They're much better at covering what you'd actually consider medically necessary in a reasonable sense. But at the same time, you have the option of buying any of those services privately, which is not the case in Canada. Now, the truth is, when it comes to healthcare spending, whether it's coming from your left pocket, which is taxes, or your right pocket, which is your own pocketbook or your own checkbook, you're still paying for the healthcare at the end of the day. And I think the important question is, what is the total amount of money we're pulling out of our pocket to pay for healthcare, and what are we getting in return? On that particular equation, Canada's healthcare system really performs quite poorly. It's a world-class healthcare system in terms of expenditures, in terms of the money we spend on it, but it's really quite a poor healthcare system in terms of access to the healthcare system itself. The Swiss healthcare system performs much better than Canada on that metric for the same amount of money, although it is true that the Swiss will bear more of a personal responsibility for the cost of their healthcare services than will Canadians.
But that's key, isn't it? I mean, we live in a country where, for various reasons over the course of a number of years, I guess Medicare came in the late 1960s, we have found it intolerable, as the Swiss apparently find acceptable, to spend much less out of our own particular pockets. Can you imagine how Canadians would react if they were told you're going to have to pay for 1/3 of your healthcare expenditures out of your own pockets? I mean, that would start a, conventional wisdom says that'd start a riot. Fair point?
I don't think it's intolerable. I think there's a lot of politics at play here, and there's a lot of momentum at play as well. Canada's Medicare system has never really had cost sharing in it, and so Canadians have become accustomed to this free at the point of use health care. In Canada, we have a system that is designed to provide high quality care to all citizens regardless of their income in a time frame that provides comfort and peace of mind. It really fails on all three counts, but we put it in place and we often proclaim its greatness in comparison with the United States healthcare system. In Switzerland, they have the same set of goals. They want to provide that high quality care to all citizens regardless of their income in a time frame that provides comfort and peace of mind, but they actually do it. The healthcare system has no queues for treatment in the healthcare system. It does provide access regardless of income. About 40% of the Swiss population, in fact, receives an income subsidy to access the health insurance program, and there are limits and exemptions on the cost sharing in the Swiss health insurance system to ensure that individuals are protected. The key difference is that individuals have to take more responsibility for their own use of the healthcare system, and that means they make a more informed decision about when and where it's best to access the healthcare program. Increasing cost sharing in Canada, or out-of-pocket spending in Canada within a universal scheme doesn't mean abandoning universal access to insurance. It actually means making a much more effective and efficient use of the healthcare resources that we have.
Okay, let me read something to you from the OECD Observer. This is a few years old, admittedly. It goes like this: whatever the role played in a health system, private health insurance has added to total health expenditure. Most OECD countries apply less government control over private sector activities and prices compared to public programs and providers. Private insurers tend to have less bargaining power over the price and quantity of care as compared with public systems, particularly single-payer ones. Now, that would suggest that Canada's got it right over some of the other systems that we've just been talking about here, but what's your view?
Well, I think it's a very simplistic view. When you look at all the healthcare systems and you try to ask the question, what does private insurance do? Again, you're asking a very different question from country to country. In Canada, you're talking about a private insurance scheme that provides pharmaceuticals, that provides dental coverage and other alternative and complementary therapies, but that doesn't provide physician and hospital care. When you get to a country like Switzerland or Germany or the Czech Republic or the Netherlands, you're talking about a private insurance scheme that covers everything within the universal health insurance program. It is true to some extent that governments have a greater ability to ratchet down spending, in some cases by fiat, by controlling prices quite directly, but there are consequences to this that we often don't reflect on, including less access to healthcare services, including longer queues for treatment. I think the best way to look at a healthcare system to understand how it's functioning is to actually ask the question, how much does it provide for the dollars that are spent on it? And again, by that equation, the Canadian healthcare system, the Canadian single-payer government healthcare system, actually performs quite poorly with world-class health expenditures and relatively poor access to physician services and healthcare. whereas healthcare systems like the Swiss healthcare system, where you see this private insurance prevalent, do much, much better, as do healthcare systems like the Swedish healthcare system, where you see that single-payer universal access health insurance program in place, but you also see a private parallel health insurance sector that individuals are allowed to access if and when they choose.
Well, let me follow up with this. The conventional wisdom again in Canada is that whether you're the richest guy in the country or whether you're Mr. or Mrs. Everyday Canada, you can't buy your way to the front of the line. Everybody is treated the same, the sicker people get treatment faster, and so on. How do the European models stack up when judged by that measurement?
In many ways, they do much better. We have this belief in Canada that we have a universal access health insurance program, but we really don't. Those who are sufficiently wealthy, of course, leave the country. Increasingly, they're less wealthy and they're going to Southeast Asia, to the Caribbean, for their medical tourism. Those who are politically well-connected, of course, do have better access to healthcare services in the system, either through personal connections or political clout. And we always have to remember that workers' compensation cases, RCMP, and prisoners get private healthcare in our own backyard under their government programs because it's more efficient to deliver healthcare that way for those groups. And so it's really not an equal access healthcare system in Canada. It's probably more of a four-tier healthcare system.
Well, that is a misnomer, isn't it? We think of ourselves as a single-tier system, but in fact there's lots of tiers, and then of course there's the United States as well, isn't there?
Well, absolutely. And, you know, I don't think we need to talk about the United States. Let's talk about a country like Switzerland. In Switzerland, regardless of your income, regardless of your lot in life, you have access to the healthcare system without queues for treatment. That insurance product is the same whether you have a very low income or a very high income, because it's provided by the same company, and you can both buy the same insurance product from the same provider. The difference is that the individual with more wealth may be able to purchase a more comfortable hospital room. They may be able to purchase nicer meals at the hospital, but that's no different from Canada as well. The difference is that that is the sole difference that you would find in a country like Switzerland, whereas in a country like Canada, you actually find differences in terms of access, and we see this increasingly in any number of studies when we're looking at healthcare outcomes, healthcare access, and perceptions of the quality of healthcare as well, in fact.
Okay, Nadeem, you've looked at lots of them. We've talked about a few of them here: Switzerland, Germany, France, Canada. I'm sure you've looked at the NHS in Britain and so on. Which country do you think has the best system that will provide the optimum amount of care for the average citizen?
You know, I don't think it matters what I think specifically, but I think it matters what the data bears out. And when you actually look across OECD countries and you ask the question, who's the very best on the healthcare outcome side, you get a group of countries including Switzerland, Sweden, Australia, France, and Japan. And then when you ask another question, say, who's the best on the access side, who has no queues for treatment in the publicly funded or universal access healthcare system, you come up with a list of Austria, Belgium, France, Germany, Japan, Luxembourg, and Switzerland. And the Japanese and Swiss healthcare systems show up prominently on both. But the one big difference is that Swiss healthcare system actually allows individuals within the universal scheme to tailor their health insurance product, and that's something you don't find in Japan. And I think that's quite valuable for individuals. In Switzerland, you not only get to pick your insurance company, but you also get to pick your insurance product, whether it's going to be the basic product, a high deductible product, a managed care product, or a bonus scheme, and you get to change insurance companies as often as every 6 months, which means there's a great level of respect for consumer sovereignty and individual preferences in the Swiss healthcare system relative to, say, the Canadian approach, where it's really a one-size-fits-all model, and we all know that one size never fits all. The Swiss healthcare system is remarkable on the outcome side, really seems to be top ranking in every measure for which we have data for their system. They outperform many, many other countries on the access side. They're doing very well on cutting-edge medicine and technologies. That's not to say they don't have their problems, but I think we would be much better off with the Swiss problems than we are with the Canadian problems right now.
But do you not have to take cultural differences into account? And by that I mean, obviously Canada is a much more multicultural country than Switzerland is, number one. And number two, we have a history of doing it a certain way that people, for better or worse, in every survey I've seen, seem to like. And the Swiss may have a completely different cultural history to the way they run their healthcare system, which may work for them. Do you not have to take all that into account?
We have to take some account of it, of course. But I think part of the Canadian cultural history is a fear of the specter of the U.S. healthcare system, though, quite frankly. I think Americans are or rather Canadians are very fond of their healthcare system because they look across the border and see the plight of a select group of Americans, and they say, well, we don't want that non-universal approach to healthcare, and we've been told there are only two ways to do it, the Canadian way or the American way, so we'll take the Canadian way, thank you very much, despite its lumps and bumps. But the truth is the Swiss healthcare system simply functions Americans better. And I think Canadians are an intelligent group. Canadians want the very best that they can get for their dollar. Canadians have clearly shown it in any number of areas of the marketplace. I think Canadians would be open to sensible healthcare reform. And we have to remember, of course, that the Swiss do have a large low-income group. 40% of the Swiss population is receiving an income subsidy for access to the health insurance system because they've exceeded that income threshold that the governments have set. So I don't think these historical dynamics play in as big a way as some folks might want to suggest. I think a lot of it is simply misinformation about what it means to have a universal access healthcare insurance program and what policies are necessary to deliver that universal access to care.
Nadeem, as always, we're glad that you could join us on the line from Calgary. Thanks so much for your time tonight.
Thanks for having me on the show.